Well, welcome back to the agenda with the Missoula County Commissioners. I'm Juanita Vero, and I'm here with my friend and fellow Commissioner Dave Strohmeyer. Josh Slotnick is out for the rest of this month, and he's getting his higher education training at the Harvard Kennedy School of Government.
Not a moment too soon. He is in need of education.
This week, we're joined by Carissa Trujillo of Homeword and welcoming back Mackenzie Javorka from the Rural Institute at the University of Montana. Dedicated listeners may remember that Mackenzie was from our episode last summer. Wow, it was a year ago?
That was a crowd pleaser. Oh, I got you got rave reviews from folks I heard from. Yes.
I can't believe that was a year ago. So about our community health worker program.
Yes.
So this week she's back with Carissa to talk about the 2025 Just Home report.
I'm wondering if before we get rolling into this, we can completely ask you some questions that are going to embarrass you. No, for some of our listeners, they may not know what Homeword is. So maybe if each of you could just take a moment and describe, that would help with some level setting.
Yeah, absolutely. So Homeword is we're a statewide nonprofit. We've been around for about 30 years, and we develop.
This is Carissa speaking.
Sorry, I could have said that. We develop affordable housing across the state. We have in 14 communities. We have 35 properties of just income restricted housing, and then we also teach first-time home buyer and financial education and provide one-on-one coaching. So kind of the full spectrum of housing.
Excellent. And Mackenzie.
So I am here today to talk about housing and the Just Home report. Last time I was here to talk about the community health worker program because I am a researcher and program evaluator. So I work on a lot of different topics. So this totally separate from community health workers, although as with everything, all of these issues tend to be interrelated. But today I'll be talking about our research that we did in collaboration with Homeword and the Community Justice Department here in Missoula on the Just Home project.
That is a great segue, don't you think?
It is. I mean,
well, what is it? What is
the Just Home project?
Tell us about it.
Yeah, absolutely. I'll let Carissa take the reins.
The Missoula County and the Community Justice Department has been involved in the MacArthur Foundation's Safety and Justice Challenge for almost 10 years now. And the idea was that they wanted to get involved to address overcrowding in the county jail. They wanted to look at the use of jail, the functionality of the criminal legal system, and then also it sort of shifted into looking at behavioral health, medical care, and then housing for this population. The Safety and Justice Challenge sites across the country were working on a lot of interventions to try to reduce jail populations, which Missoula County did, but kind of resoundingly across the country, people were like, we can do a lot of these really incredible interventions, but our folks don't have anywhere to live. And if they don't have somewhere to live, it's a lot harder for them to kind of go through these interventions, actually be successful and stay out of justice involvement. And so that's where Just Home came in. And that was MacArthur Foundation was trying to address that housing need for the justice involved population. And they chose a couple of the current SJC sites to fund so that we could do some research and really dig into who is this population, who is justice involved with housing insecurity, that maybe a housing intervention will help them reduce, recidivism and that sort of thing.
What's the spectrum of justice involved?
For our purposes, and MacArthur's really aligned with, it's any level. So it's from someone who is actually incarcerated themselves to somebody who is maybe impacted by a family member's incarceration. In Missoula County, the two populations that we decided to focus on were transition-aged youth, 18 to 24-year-olds who were in the foster care system or in group homes, or just 18 to 24-year-olds who are housing insecure. And Mackenzie's going to talk about the research, but 89% of the youth homes kiddos that they interviewed had a family member with justice involvement. And so that family member's justice involvement really negatively impacted their housing security. The other population that we've chosen to work with are families who are impacted by justice involvement, really looking at like the Meadowlark facility, the YWCA's population, and people who've maybe had domestic violence in their past. So again, another family member's justice involvement has negatively impacted their ability to find housing. And so we're looking at the full spectrum of what that means, whether it's direct justice involvement or somebody in your family that's making it harder for you to find housing.
And so folks can get an idea of the scope of the population. We have numbers before we get started? Like how many people are we talking about?
In terms of the number of folks who are unhoused and involved in the justice system?
I guess maybe I'm thinking of unhoused, or that for the Just Home project, the population we're going to talk about today are the 18 to 24-year-olds who are housing insecure and who have been involved with the
Yes.
justice involved. So how many of those folks are we talking about?
Yes.
What's
So
that number?
what we found was that transition age youth ages 17 to 24 comprise about 10% of Missoula's unhoused population based on data from our Missoula coordinated
So
entry
it's like
system.
50, is that about right?
I think it's around in the 40s.
Okay.
If I
Yeah,
remember correctly.
yeah, I think that's
So-
And
so
something else that we found out when we were meeting with like partner organizations to talk with them about this population is it's also a severely underreported group. There's lots of couch surfing happening, and so they can't get into the coordinated entry system. There's also just a lot of, I'm fine. I'm sleeping on my cousin's boyfriend's
Right.
aunt's house, and I'm
Right.
totally okay. And so there's also some pretty severe underreporting with the kids in this group.
Okay.
So Mackenzie, what were you looking at in this report? What are the data?
Before I kind of jump into the findings a little bit, I want to talk about kind of like what we looked at for this report. So we analyzed administrative data from the local homeless management information system, which is populated with data from all of the local service providers who participate in Missoula's coordinated entry system. So that gives us a pretty kind of comprehensive picture of unhoused folks in the Missoula area. And then we also looked at data from the Missoula County Detention Facility using...
Sorry, I'm not sure. Do you think listeners know what coordinated entry system, though?
Oh, coordinated entry system. Yeah, I don't know if I'm the
Yeah, no, I
best
can
person to define
I can
that.
speak to that.
Okay.
So the idea with coordinated entry is that there's one centralized sort of tracking system for folks who are houseless in our community. And before that, it was really piecemeal. We have really incredible service providers around the community that have various types of support and financial support and such, but folks had to go to each one individually, and it ended up being sort of a challenge to ensure that the services and the resources were being equally and appropriately distributed. Like the squeaky wheels were getting a lot of the resources, and the folks who didn't have the skills to advocate for themselves were not. And so the city of Missoula has this coordinated entry system, and folks come into the system at various entry points, and they are ranked based on a survey of risk associated with their actual risk out in the community. And that allows then resources to target the folks appropriately, so the people who are at the highest risk of dying on our streets can have the most intensive targeting of resources. And then folks that are lower on the coordinated entry system list, maybe there are other ways that we can help mitigate that. Is there diversion efforts that can be made? Is there another way that we can kind of help them get creative to get more housing secure? And so it really allows the community to target their efforts appropriately to each of the individual's needs.
And why did I think coordinated entry was something that was statewide?
There is coordinated entry statewide. That is correct. So we're connected with the statewide coordinated entry. And so if somebody was houseless in Billings and they came to Missoula, our Missoula team would be able to access their information.
Great. Okay.
Yes.
Thanks for that. Sorry,
Yeah,
Mackenzie, didn't
no,
mean to-
thank you for the explanation, Carissa. So we were able to access some of the data from that system and also combine that with data from the Missoula County Detention Facility, which is our local jail, and looked at records from when people were booked into jail over the past several years and what they were booked for. And we kind of focused in the jail data on 2023 because that was the most recent year for which we had complete data for the entire year. And then in addition to those kind of quantitative data pieces, we also interviewed 26 local service providers and systems staff, systems personnel across the areas of housing and shelter providers, the justice system, reentry services, healthcare, and youth services. So we talked to a lot of folks for this project. And then in addition to all of that data, we also held 2 community pop-up events in which over 60 young people and adults participated who had themselves experienced homelessness or were currently experiencing homelessness or housing insecurity and or justice involvement. So we combined data from all of those different sources to kind of really give a comprehensive picture of how housing and justice involvement are really deeply intertwined.
And coming out of all of that, any top of mind findings that you arrived at?
Definitely. So we have a lengthy report which is published on Homeword's website, and folks can dive into that if they're interested in all the nitty-gritty detail. But in terms of really kind of broad, high-level findings, what we found is not necessarily new or surprising, but is that being unhoused increases the likelihood of becoming justice involved, and vice versa. Having some kind of justice involvement or criminal history increases the likelihood of becoming unhoused or struggling to stay housed. That criminal history can really be a barrier to accessing housing resources or, being competitive on the private rental market, for example. So piecing those two parts of kind of this cycle out a little bit more, what we found and what we heard from service providers as well is that unhoused folks are often at higher risk for becoming incarcerated or ending up in jail simply because they kind of have to live and exist in more public spaces and are subject to a lot more public scrutiny of behaviors that, if you or I were to engage in the privacy of our own homes, we wouldn't necessarily result in the police showing up, right? Or they might engage in survival behaviors like trespassing because there are limited places where they can kind of legally exist or spend time. So those are some of the ways that being unhoused can increase interaction with the justice system. And then on the opposite end, once someone is coming out of jail or has a criminal record, we heard time and again from providers that this can make it really, really hard for them to secure housing on the private market, especially in what we all know is a really competitive housing market here in Missoula, or to qualify for things like public housing assistance, especially if you have certain kinds of charges on your record, then you can't qualify for HUD vouchers or things like that. And so this is kind of was already a well-established cycle in kind of the research literature that's been done in this area, and it plays out here in Missoula as it does in many places. But there are some particular kind of aspects of what this looks like locally that stood out in our research. So in particular, we heard that Native American residents are both disproportionately represented among people who are unhoused and among folks who are booked into jail here in Missoula. So even though Native Americans only make up about 2 to 5% of the Missoula County population, depending on how you measure race and ethnicity, they make up about 15% of our unhoused residents here in Missoula. And in 2023, Native Americans made up 25%, so a full quarter of all of the unhoused individuals who were booked into the county jail, not having an address at the time of booking. And so that kind of says that even just among unhoused folks who are already at this higher risk for incarceration, Native American individuals are being disproportionately incarcerated compared to the numbers in the overall population, right? That's a pretty staggering disparity. And our study wasn't set up to answer exactly why that disparity exists, but in the report we do kind of provide some context about, historical displacement, over-policing of Native folks that might help contribute to what we see today. And then another thing that we found is that the most common charge among folks who were unhoused when they were booked into jail was for failure to appear. So meaning that these folks were jailed because they didn't appear for a court date, either as a defendant or as a witness or something like that. And failure to appear charges made up about a quarter of all jail bookings for unhoused folks in 2023.
How many times can you fail to appear before before you end up in jail? Or how's that work?
This is going to be someone who has a pattern of not appearing for court. And we can probably all think of a lot of reasons that appearing in court might be a struggle for folks who are currently unhoused, kind of focusing on daily survival, or folks who might be dealing with untreated mental health or substance use issues, but then they can end up kind of cycling back through the jail because of that failure to appear. So we can get into this a little bit later, but I think this was one of the really kind of actionable, preventable data points to come out of this study. And there are some things already kind of being done in the Missoula area to try to address that particular finding.
Well, speaking of things being done, did you encounter any bright spots in our community, either city or county, where some of these issues are being addressed effectively, even if not completely?
Yes, absolutely. So we kind of looked at and compared what currently exists in Missoula to some of the evidence-based practices or best practices out there. And there were several programs or models that Missoula has implemented that align with the evidence base for what works to help kind of interrupt this cycle of homelessness and justice involvement. One of those is having a coordinated entry system, which Carissa just talked about. That really allows for that data-driven approach to help track and support people and dedicate the resources to folks who need it the most. And we also have some amazing collaborations between the municipal court and other service providers like the Pavarello and the library that can really help reduce those failure to appear charges and bookings that were happening. So one of those that has existed for a little while now, I think maybe about a year or so, is called Shelter Court. And that takes place monthly at the Poverello, used to take place at Johnson Street as well. And that allows for unhoused folks to appear before a judge via Zoom for misdemeanor criminal charges. So that's a really great way if someone is, repeatedly not showing up to their court appointments, to make sure that they can appear before a judge in a place that they might already be staying or might be more familiar with, more comfortable with. Another great collaboration is Resource Access Days at the library, which is another opportunity for folks who might be unhoused or housing insecure to connect with all kinds of different service providers from the community, including...
How often do we have Resource Access Days?
I think that's monthly.
Okay.
I believe that's monthly. Yeah. But that happens every month at the library, and folks can connect with pretrial assistance services, lots of other great community resources. So those kinds of creative collaborations are really exciting in terms of opportunities to help hopefully divert more people away from the jail and make it easier for them to eventually receive kind of housing supports and other things like that. And then one other program I want to mention that is newer to our community and really promising is Blue Heron Place. So that is permanent supportive housing for folks who might need a little extra support to stay housed. And that has already seen some great success. And Chris, I don't know if you have any of those.
Yeah, tell us what success
numbers.
looks like
I
at
don't
Blue
have them
Heron.
off the top of my head.
That's okay. I didn't mean to put you on the spot.
I can find them.
But that has already seen some great success in terms of residents' interactions with police or the justice system going way down while they're housed at Blue Heron Place. And then another really exciting kind of up-and-coming thing here in the community is the new Watershed Navigation Center, which is located right next to the jail. And so that is intended to provide a whole kind of array of healthcare and other social services for folks, and especially folks who might be reentering the community after exiting the jail, that it's right there. They can walk right over and kind of be this one-stop shop for all of these services they might need to reconnect with after exiting the jail. And that one is really cool because I know there's been a lot of intentional effort to make that space culturally responsive for Native American community members as well. So those are just a few of the exciting bright spots in our landscape assessment.
I don't mean to go back to the dark spots, but I wasn't sure if you mentioned the population of natives, or they represent 25% of the houseless, homeless jail population. And then the most common charge is the failure to appear. But were you saying something about youth or foster or the age of these folks?
Yes. So that was the other kind of key finding from our report, is that the transition age youth population can be kind of particularly vulnerable to getting caught in this cycle of housing insecurity and justice involvement. So they're not necessarily
Making up a significant
Yes.
percentage in jail, but they are just
Yes.
very vulnerable.
Exactly.
Okay, got it.
And that can, as Carissa kind of mentioned at the beginning, if they have parents or family members who are justice involved, that can then impact their ability to stay stably housed. And so those impacts can really kind of trickle down through the generations, because not having a stable place to live growing up or support consistently from trusted adults makes it really hard for young folks to transition successfully into living on their own, holding down a job or going to school and maintaining that stable housing. And then, as Carissa also mentioned, young people are also often undercounted when it comes to homelessness or housing insecurity, because they might be couch surfing or staying with friends or things like that. And they're also a lot less likely to access traditional homeless services like shelters. A lot of times those spaces don't feel particularly safe to young people, and that's something that we heard in our community pop-up events as well. And so a lot of times young people just don't know where to go for those resources or for help.
So we often hear that foster kids fall through the cracks. So what causes that?
We heard a lot when we were meeting with various service providers that there's excellent support for folks who are under 18, but once kiddos hit the age of 18, it's a lot harder for service providers to require support, and they really have to go out and be really self-motivated to access resources and services. And as Mackenzie was referring to, a lot of them are not as used to accessing traditional. They're figuring it out on their own within their circles, whether or not those circles are safe. And so I think that's really when we see that gap for kids when they're falling through the cracks, is because there's such incredible support until they turn 18, but then having those youth access support after 18 is a lot trickier. we're working with Youth Homes Transitional Living Services program, which is a specific program for kiddos who have been in the foster care system or in a group home, where they actually have case management support until they're, I think, 24. And so the programs exist, but the youth have to opt in, right? It's not like they're living in a group home where you can kind of require that programming. Once they turn 18, they get to act of their own free will and make those choices for themselves.
Yeah.
A lot of what you're describing, I'm guessing, is found in other communities across the country. I'm not thinking that any of this is particularly novel here in Missoula, but I'm just guessing. Well, in terms of this report and the research related to the report, did you do any comparison with other communities across the country, and where do we kind of sit juxtaposed next to that?
Yeah, so we didn't kind of explicitly compare Missoula to other communities, but we definitely looked at the literature out there and research out there on the national picture. And like you said, Missoula is not unique in what this interaction looks like between housing and justice involvement. I think some of the things that are unique are kind of our particular demographics, right? And how this issue maybe particularly is impacting our Native communities. That is something that is more unique to the Missoula area. And I think also just the realities of our current housing crisis that we're in here as a state and as a community. As housing costs go up, homelessness increases. That's a very well-established data point. And so because housing costs here are high, we also are seeing it be even more of a struggle for folks who have any kind of justice involvement to compete in this really tough market.
And part of the work that we did with Just Home was actually to do some site visits to other Just Home communities and see what kind of interventions that they were working on. So we've been to Sioux Falls, South Dakota, and Denver. We went over to Bozeman just to see what other intervention options might be available. And there were some really incredible models, some that focused on just folks who were on the registry or family housing or youth-focused housing. And so we were able to see a couple of different models that may or may not work for Missoula, just trying to see the kind of spectrum of options out there when it comes to these kinds of housing interventions to decrease justice involvement.
So based on your experience in some of those other communities and the ways in which they've approached these challenges, are there some potential options that you would like to pursue or that you think would be more successful than others and within reach here?
I think there's a lot of different options, and there's some really neat models that really hyper-focus on those types of the populations that we're talking about. And I think the biggest challenge that we face is just land and cost associated with creating new developments and new housing right now. But what we're hearing from the service providers across all of our meetings with them is they need more houses for their people to move into. And that's been our primary focus right now, is just trying to find some units to put folks in. The next layer, I think, is really looking at how can we get some more targeted permanent supportive housing. And so is it permanent supportive housing for a youth population or an SVOR population, like housing that's really targeted at youth or folks who are on the violent and sexual registries. We have a lot of really incredible models that we'd like to do. Making them financially feasible, I think, will be the trick.
So I'll cut to the chase. I never like hearing that Bozeman's doing anything
they have a really
better than we are. So just lay it on us. What's going on over there?
So I think Bozeman has a similar model to Blue Heron Place. Actually, they have.
So we were first.
They have.
I
don't know if we were. I don't know in housing. Oh. So it's called Housing First Village. So whereas ours is like an apartment complex, right, with like a secured entrance, they have some tiny homes on a piece of land that they own. But it's the same sort of low barrier. Services come on site to help, with whatever personal goals that the residents have if they're working on addiction or mental health challenges. I
think I've seen that from the interstate.
Yep,
so
incredible.
These tiny homes, they're maybe a little more permanent than, say, our temporary safe outdoor space, TSOS. So describe what these are.
And honestly, I think that Housing First Village is really similar to our temporary safe outdoor space in its model, where folks have their own small space that's all theirs. They can lock their own door and have their own little home. But they're tiny homes. They have an architecture school in Bozeman, and so their architecture students actually came and helped build Housing First Village,
really?
Which is pretty cool. Yeah.
The other thing I think that is a little bit of a difference is I believe there are some sobriety requirements related to TSOS that we heard about. And I don't know that those same sobriety requirements exist in the
You're correct.
the Housing First Village. So
And the
a
Housing
little
Fir-
bit of a lower barrier there.
Lower
Okay,
barrier
that's-
housing first.
Yes.
And so with the Housing First Village, are those homes seen as transitional in some sort? Because definitely with TSOS, this is a place for folks to reside on their way to finding permanent housing. Is Housing First in Bozeman the destination for some, as opposed to just on a path to somewhere else?
It is. It's permanent supportive housing in the way that Blue Heron Place is. And so the idea is that if somebody wants to stay there forever, they can.
Okay.
It's low barrier, and you're trying to provide folks services so that they can grow into whatever future goals that they have for housing. And a lot of folks do then eventually transition out, but the goal isn't to have it as transitional housing. It's to provide stable housing for folks who are at the highest level of that coordinated entry system, who are most likely to die on the streets.
Interesting. Carissa, could you give us some of the stats about Blue Heron?
Happily, yes. So in our first year, one of the goals for permanent supportive housing is jail diversion, right? It's taking folks who are housing insecure and likely justice involved, who are at the top of that coordinated entry, and giving them a permanent, stable home where they can then have the space to actually address any addiction or mental health challenges, medical health challenges that they have. And so in our first year, Blue Heron Place is owned by the Missoula Housing Authority and Homeword, and our partners at Partnership Health Center are the ones that are on site providing the support. And then the Poverello Center acts as our overnight staff. And so it's like an all hands on deck team effort there. And within the first year of operations, we saw 74% of the residents maintained their housing.
Maintain their unit at Blue Heron.
Yeah,
Yep.
they didn't get evicted. They
Yep.
didn't move out. And these are folks that some of them have lived on unhoused for over a decade. And the folks at Partnership teach things like how to use your stove and how to, maintain a lease and those sorts of things. Like that's a lot of it's new information for the residents that live there. We had 84% that had positive housing outcomes. We did have one person who needed to move into a higher level of care facility, but that's still a positive outcome because we were able to get them more into a place that's more aligned with what they need. We saw a 62.5% reduction in jail bookings for the residents at Blue Heron Place in the first year.
We're talking about 40 people? What's our
30.
30.
I think we're at 32
Okay.
because we have a couple of couples. And then we saw reductions in emergency department usage as well. We had one resident who had 20 visits to the emergency department with 41 inpatient days in the 9 months before moving into Blue Heron. And then in the 9 months after, that same resident had one visit with 7 inpatient days. Permanent supportive housing is taking pressure off of some of these systems that are really carrying the burden for a lot of the folks who are unhoused.
Mm-hmm.
Thanks for pulling that up. That's great.
It's pretty stark comparison that you've just laid out in terms of helping enrich the narrative of what we're talking about here in the general public. What opportunities are there to get this story out, a success story like Blue Heron Place?
I mean, I think between Homeward and the Housing Authority and Partnership Health Center, we are trying to talk about those successes as we're also learning. This is our first attempt at full permanent supportive housing in the community, like where we have 24-hour on-site staff. And we're learning a lot about how to model it differently and what works for, success for the residents and the caretakers that are there on site and what doesn't work. And Homeward is actually building a second permanent supportive housing project in Great Falls right now. So we're trying again over there.
That's great.
So we have a report. Now what?
Actual next steps.
Yes, actual next steps. Well, I think I'll let Carissa talk a little bit about next steps as far as kind of the transition-aged youth population and families. That is kind of the focus of the Just Home grant and project. We do highlight quite a few other recommendations in our report, so I won't cover them all here. But I think a couple that really stood out to me, especially when we asked folks with lived experience of homelessness or incarceration about what they needed. One thing that we heard a lot was desire for greater understanding and acceptance of them being here in Missoula. And I think there's some real opportunities for community-wide work on reducing stigma related to homelessness, educating folks in our community on kind of what are the root causes there, and creating more opportunities for positive interactions between housed and unhoused Missoulians. So that's kind of one of the things that stood out. I think another thing specific to this population of folks who are unhoused and have been involved in the justice system is transitional housing, specifically upon reentry from jail or from prison, having more sober living opportunities here in town, having more halfway houses, things like that. They exist here in Missoula, but the demand is so great for those places, and we're just not meeting the demand currently. We might have a place that has 7 beds, and we have a lot more need than that in the community. So I think that was another kind of potentially actionable next step. Obviously it takes a lot of resources to develop and run those kinds of transitional living spaces, but
if we magically had the housing stock to do this, like do we have the service providers or folks who are educated in this work?
That's a great question. I think what we heard a lot from the service providers we talked to is around, of course, funding for a lot of these social safety nets, right? What we heard is that what is always available 24/7, it's the jail and it's the emergency room.
Yeah.
So I think that was kind of a consistent through line in our interviews that we conducted, was not necessarily that we don't have the providers, but it's sort of a chicken or an egg thing of, if you don't have funding for the providers, then we can't get the providers.
I think Missoula County has such a rich landscape in providers, and a lot of folks are already working with this population, the justice involved and housing insecure population. There are a lot of service providers that are already in contact and trying to support them. And so if there was a place that they could go that was centrally located, if there were homes that they could actually get folks into in a safe way, I think our service provider community is really motivated to try to do better for their the populations that they're serving. And resources are challenged, but they're at the table and they're ready to have these conversations. We've been having convenings with folks about the transition-aged youth population, and nobody has the time to step into the space fully, but they're all there for the conversation, and they're really wanting to see if we can find a solution as a community. And so I do think that if we could get more roofs for folks, it would make a positive impact, because it's, things like the case managers would know where to find their clients in a much easier way if they're not, in a houseless situation. And so I think if we had more spaces for people, and if we could provide this more targeted approach, it could really benefit the folks who are impacted by houselessness and justice involvement, but also the service providers being able to focus
their work
differently. Yeah.
Has there been any, and my mind keeps going back to a couple things. One, the need for resources to do the sort of effective work that you're describing, but also to the success story that you painted a picture of at Blue Heron Place, where folks who are housed there are not nearly as frequently going to emergency rooms here in the community. And I'm just curious, has that, just from a dollars and cents standpoint, has that been quantified? Because clearly there's a direct benefit to our healthcare institutions here if they are not, in many cases, probably eating the costs of folks coming and using services and not either through insurance or otherwise paying for it, which would seem to be a big incentive for healthcare to invest in some of these housing options.
Yeah, absolutely. You can quantify what's the cost per night in the county jail, what's the cost per night in the emergency department. And I think the good news is, the Strategic Alliance for Improved Behavioral Health is absolutely a part of these conversations. And so I think folks really are looking at this holistically. I don't think that it means, we've got these 30 people, so give us this money and we'll run the place. But there are models for that in other communities. South Dakota has a model there where they have larger emergency department systems that will pool money in for diversion efforts like this. And so I think there are models out there, but we're so new to actually tracking the interventions and their outcomes that I think we need a little longer to actually make a case. And our goal is also to make this effort statewide and really look at the different housing interventions that are happening across the state and how can we quantify that in positive outcomes and then taxpayer savings, really, frankly. And is there some way that we can then leverage that for some sort of state legislative efforts?
Well, as luck would have it, the legislature will be in session again in 2027. So we've got a little bit of time to work on that. So justice involved, which we've been using that terminology here today, is a broader category than simply someone who's incarcerated or accused of or convicted of a crime.
Yep.
Can you talk maybe just a little bit, either one of you, Carissa or Mackenzie, about the importance of maybe a shift in language?
Yeah, absolutely. So as you were indicating, justice involved refers to folks who might be involved in the justice system in a variety of ways. So they could have had direct interactions with the police. They could have spent time in jail or prison, but it can also refer to folks who maybe were a victim of a crime or whose family members have had contact with the system. But another important reason that we use that language of justice involved individuals rather than terms like offender or inmate or something like that is because those can be really dehumanizing, and they define somebody only by something like whether they've committed a crime or gone to jail, when they are a whole person who, that is maybe one piece of their story, but it's certainly not the entire piece. And those kinds of labels can come with all kinds of kind of assumptions or things that jump into our mind that may or may not be true and can be kind of stigmatizing. Might have very little to do with who that person is outside of their justice involvement. So that's why we try to use that more person-centered language of justice-involved individual.
Thanks.
Thank you.
Well, in the spirit of sucking the life out of our guests or every bit of information we can, we always like to end our podcast with an opportunity for our guests to share a little something of what has inspired you lately. It could be a book, it could be something visual, it could be something you've heard, it could be none of the above, but this is your chance to give us all a nugget of inspiration or wisdom.
Are you going first or am I?
I can go first.
Right.
I've got one. I have been enjoying a kind of a lighter read this summer. I did just finish rereading the Parable of the Sower, Parable of the Talents books by Octavia Butler, which are not light at all. But to kind of bookend that, I've been reading the Murderbot series by Martha Wells, which for any sci-fi fans out there, they are excellent. They're quick little novels, and I believe there's even a TV series now. It's been adapted. I think it's on Apple TV. I'm not being paid for that endorsement. But they're very entertaining. They're about kind of a artificial intelligence bot that has a soft spot for humans, and so highly recommend.
Okay.
So
Fantastic.
timely. Yeah.
Well, and I read for pleasure, and none of my books are really that deep. But I have been, Mary Oliver is my favorite poet, and I've been getting back into her. And I think that the thing that I was thinking about with this question was how she really encourages the reader to reflect on the present and, notice things around you, especially in nature. And I think with the work that we do at Homeword and the incredible team that I have, it's been really, I like reading her poems and sort of slowing down to see the good in all of the challenges that we have, and see the incredible work that we do and the partners that we have in this work, and trying to move the needle forward in a positive way and not getting bogged down in the mire of it. So that's my Mary Oliver story.
Do you have a favorite poem?
I like the summer day, what will you do with this one wild and precious life? I love that one.
Well done.
From Murderbots to Mary Oliver.
It's a good spectrum. Yes.
Thanks so much for joining us today.
Thank you all.
Yeah, thank you.
Thank you.
Thanks for listening to The Agenda. If you enjoy these conversations, it would mean a lot if you'd rate and review the show on whichever podcast app you use.
And if you know a friend who would like to keep up with what's happening in local government, be sure to recommend this podcast to them.
The Agenda with the Missoula County Commissioners is made possible with support from Missoula Community Access Television, better known as MCAT, and our staff in the Missoula County Communications Division.
If you have a question or a topic you'd like us to discuss on a future episode, email it to communications@missoulacounty.us.
To find out other ways to stay up to date with what's happening in Missoula County, go to missoula.co/county updates.
Thanks for listening.